happen into the axillary area and also into the truncal area. And some of the symptoms of lymphedema include visible swelling. It sometimes can be painful. Sometimes there is no pain involved. There's usually a visible difference in size between one extremity and the other. And there's usually a full, heavy feeling that women complain that they feel in the affected arm. Lymphedema can also be primary lymphedema, meaning someone can be born with an impairment in the lymphatic system, but breast cancer-related lymphedema is considered secondary, and it's one of the most common causes of lymphedema in the United States. There are more people who are surviving breast cancer, therefore you have more women who are walking around that have the potential to develop lymphedema, and there is definitely treatment for that. So there's different stages of lymphedema. If a woman has breast cancer surgery, she automatically is placed into a stage 0, which means there's the potential for the extremity to swell. Stage 1, there's definitely visible swelling, and at that point it warrants a referral to a physical therapist or a lymphedema therapist that can help treat that. Stage 2, you can start to see increased swelling as well as skin changes and skin infections, which it becomes more difficult to treat, but it's still manageable at that point. And there's also a stage 3 lymphedema that's called elephantiasis. Some people may have heard of elephant legs or elephant arms. You see the really huge sizes and extremities. That's stage 3, that's very severe, but most of the people that I see as a healthcare practitioner are usually in that stage 0 to stage 2 phase. So the gold standard of treatment for lymphedema therapy is called complete decongestive therapy, and there are 4 components to that. So number 1, you have manual lymphatic drainage, which helps to reroute fluid out of the swollen extremity to the healthier areas of the body so that the fluid circulates the way that it should. Once that fluid has been moved from manual lymphatic drainage, you also need some form of compression, whether it's the form of compression bandages, really nice compression gloves, sleeves, and gauntlets. They make them really cool now. Some of them have different designs and designer names on them, so you definitely want a form of compression. Exercise or decongestive exercises to also help promote the fluid flow is also recommended. And again, lymphedema can affect your skin integrity. Swelling that's been there for a long time can change the integrity of the skin and the tissues, and it can make it hard, and it can cause fibrosis, which is just a hardening and a thickening of the skin. So skin care is a very important component of complete decongestive therapy for lymphedema. A common question that I get is, well, now that I have lymphedema or I'm at risk for it, is it something that can be cured? So currently there is no cure for lymphedema, but there's definitely management techniques. There are different surgical procedures that are out now. They're like lymphovenous anastomosis or lymphovenous bypasses that are available, lymph node transfer to help reduce the volume of swelling, but that's usually done in extreme cases. But again, the gold standard of treatment would be complete decongestive therapy.